Okay. Hi guys, welcome to the second episode of Medverse podcast. This is your host Syed Abdul Rafi and my co-host Shashank Kumar. Today we have a very special guest with us, Dr. Vishnu. He is one of the rare people, I would say, who has done his studies from top central institutes of India and a huge inspiration for us all. So I'd like to welcome Dr. Vishnu sir to the podcast. Hi, sir.
Hello, both of you. Glad to be doing this.
How has your day been, sir, today?
Yeah, it was great. I have a a same as like doctors, somewhat as the cliche goes, always busy. So tomorrow I have a case presentation, etc. So I'm kind of preparing for that.
Oh, so you've been busy with your cases, I guess.
Yeah, yeah.
Uh, so you're probably taking a valuable time out of you. Um,
Yeah, nothing like that. We are always busy, so it's like that.
okay. So, sir, nothing but we are just med students, sir, in
Yeah.
our final year MBBS, and we are really looking up to you. Like, you're a huge role model for us. So, we are basically coming here today for just let's say you're a senior in our college and we are just juniors asking for life advice and anything in general. So we'll start with my first question. That would be, what inspired you to take medicine as a career?
So to be very honest and frank, it was somewhere in sixth or seventh when not me but my parents decided that doctor being a doctor is a good field. Like they basically hail from a government service kind of sector, like the Indian Information Service, and my mother is a bank manager. So that kind of conventional sector, not a doctor or not even an engineer per se. So they felt that doctor is a good, as we all know, right? Societal respect and
Yeah.
decent money, etc., etc. And for me, at that point of time, we used to stay in Delhi, right? So at that point, we used to stay in Delhi, and I always used to miss my older school, older friends, my grandparents, etc., who used to be in Hyderabad. So one thing that obviously it kind of clicked, that doctor has somewhat of this option of having an independent practice, of living in their own place, right? So not no need to be tied to a government or something where you have to, or even a bank where you have to go where they say. So at that point, that was one of my main reasons. Although later I did have thoughts of, like, it's very difficult, etc., through MBBS, like I think everybody does. So all that did happen, but eventually I think, if I look retrospectively, one thing is that this is one branch where intrinsically there is a certain level of impact that you have on society. For example, if you're doing IIT or you're in finance, etc., obviously you'll get paid more, even for the work you put in. But at the same time, you will always have that kind of doubt whether I'm doing something impactful. Essentially, you're working for a company, right? You're working for a company that is making money for itself, from which you're getting a fraction. But are you directly doing something? So those kind of professions, ultimately people do something on the side to quench this thirst of creating an impact. This profession in itself has that particular thing ingrained in the profession itself. So retrospectively, if I think, that is one very big added pro of this branch. Yeah.
So making an impact in the world, you would say.
Yeah, again, I wouldn't say I took the decision because of this reason, but retrospectively, that is my main liking for this particular field which I am in.
That's great to hear, sir. So I mean, a lot of us just choose it out of a second option out of two of those options.
Yeah, yeah, yeah.
Yeah, so that's great. Another thing, I think you gave your AIPMT from your inter, and so you got rank and you got into AIIMS-Delhi. So how was that, sir? Like, what was the feeling around that time?
So uh, which MBBS batch are you actually?
We are in 2021 batch.
Okay, so I was 2011, right? So long time
Oh,
before. So that time it was quite different, like at that time there was something called MSET. I don't know if it's there
Okay,
now.
okay, yes, yes. I'm set.
So at that point, our syllabus was completely different from the national thing.
yes.
So I was in Chaitanya, Sri Chaitanya, and they used to teach only MSET, that is the state PMT things. And the syllabus was completely different. There was no human physiology. There was earthworm, annelida, and this, cockroach physiology, which was focused upon. There was no human physiology at all. It was very different, like at least 60-70% different from the NCRT. So nobody used to go to all these central institutes from Telugu states. They used to give MSET, get into MSET, stay in Osmania Gandhi. That was how it used to happen. So I kind of tried extra to like I went to Kota, Allen for 2 months, 2-3 months, studied there, etc. And I could get through. Like I got, like, again, there is a lot of luck involved in those exams. My physics chemistry was strong, so I could get through, and luckily I could get into top 10, and then went on to AIIMS. But otherwise, if you look at it at that point, it was very different from what it is now. Now it is much more streamlined for Telugu people, not in general. That time it was very haphazard, and something I could
Mm.
study in that Allen, whatever they taught, and I could get through. I don't, to be very honest, it's not very relevant. My journey is not very relevant from a specific point of view in today's time. It was different
But
then.
I mean, it was a
But it was tough
pretty
in
different
terms
thing.
of,
Yeah,
yeah, in terms of toughness, and in terms of efforts put in and all. It's same. Maybe it's much more now, I think, because now the competition is obviously as
yeah,
time goes on, competition keeps increasing. And now I think everybody knows you have to read NCRT to get through. And right, as far as I know, I think everybody knows, and it's just that luck factor has increased even more, I think, now, because it's just one question and your rank goes here and there. That's what I have a feeling. But yeah, that time it was much, I would say, easier, and but at the same time the seats were also less. So yes, it's tough only,
was,
whether it be whatever.
yeah. I would say it wasn't as well known as it is today, right? The
Yeah,
institute, there weren't
central
so many
institutes,
institutes.
especially for Telugu people, was
Yeah,
very, yeah.
exactly. So almost paving the way for us Telugu students, I would say.
Maybe, but yeah, see what happened in 2014 was they changed the syllabus, and it was never a a factor of talent or something. When where we were there in IIT, etc., we like Telugu students were anyways there. So when the syllabus changed, the students came. Uh, a lot of Telugu people are now there in AIMS. 2014, I think, was the batch where I think there were directly 15 people from 0 to 15. It went like that. It was 2013 or 14, something like that, when syllabuses became equal. So it was more of syllabus thing, not that I paved the way. Yeah.
Okay.
So, on the note of talking about the entrance exams, how do you think NEET PG is different from INICET, sir? Like,
From the INI-CET PG, right?
yes.
So uh, I would say the only thing is the number of seats. Otherwise, if the number of seats were supposed equal, I would say INI is a much easier exam to crack. Mainly because it is much more predictable, right from the date of the exam to the date of the result to the pattern to the questions. It's much more easy to predict. It has a lot of repeat topics going on, a lot of repeat, directly repeat questions, a lot of repeat topics. In that sense, it's much easier. Conceptual wise, I don't know. As far as I've heard, nowadays NEET PG is also decently conceptual. It's not like NEET PG is very raw. That was the earlier impression, that NEET PG is lot more fact and rote learning based, but I don't think it is the case now. I think decent conceptual questions are coming in NEET PG also, but yeah, it's very unpredictable. And if you actually sit and see the previous questions, for example, now it is 2025. If you see 2020 to 2023, you jot down the topics, and don't see the next questions. Just see the first
Mm-hmm.
3 years, jot down the topics. Then you open your 2024 and 2025. Then jot down the topics, or maybe you both can do it separately, and then you match, you'll see a lot of match. But that match
Okay.
won't happen with your NEET PG.
So
So that way, this is something that not everybody knows, right?
yes,
That
sir.
this level of repeat things happen. This is something that, students from, for example, students from MBBS AIIMS, they focus almost only on INI CET. They don't, focus on NEET PG. That is how it goes usually. But that's the environment that is there created only. Ki INI only we will give for, because there are three entrance, three institutes also now, three, four institutes. So they keep giving that, and exam is also 6 monthly. So they will focus only on that, and they know these small things. So that is also why a little bit they keep getting there. So these are some, just if I can say, tips or tricks that I would like to share about INI. Otherwise, yeah, your logistic things are always there. I think INI goes in 4 sets of 45 each or 50 each, like mini tests kind of format, while NEET is one big exam. Those things are there, but generally, this is the thing, like a little bit more conceptual is INI, and more repeat topics are asked.
Okay.
That's the difference.
And what about like sources to study? Uh, Nowadays we are learning, like we are getting to know about these coaching apps. So what's your opinion on how to learn for these competitive exams? Like,
See, to be very honest, my opinion might differ from some things that you may see on online or something. So I feel that firstly you decide how much you want to spend time on reading. So I can go and say ki you read Harrison's and Bailey's and whatever the standard textbooks are. But for example, you may decide that, okay, I don't want to spend 6 hours a day every day almost for the whole year. I just want to
mm-hmm.
spend like 3 2 3 hours a day, and then finally just before the exam 10 hours I'll do before 3 2 3 months before. You may think, right, you may not
Yes.
want to spend so much time. You may have your own priorities. If it is like that, then going for coaching is like, your online coachings, whatever, be your doc tutorials or Marrow, etc. All of these are very good options. But if you want to do it the proper way, the ideal way, then obviously I would say go to the standard textbooks. Again, don't read line by line, but ask your seniors, see previous papers of your what are your viva questions that are being asked, and focus on those areas from standard textbook. That's the most ideal way. But again, you have to have that understanding of yourself. Can you do it? Do you want to do it? That is more important. That is something that very few people do. It's very difficult also. I would say, at that age, even I didn't have that uh, kind of understanding that, okay, I might not be able to do only like this is final year, I have these all these things, I can't study only this much. So that kind of thing, understanding is difficult, but if possible you should do that, and then decide what to study, where to study.
Yeah.
So, if I don't know if you have heard about our batch. What happened is NMC has declared like all our so they've tried to implement next exam for us. So based on that, they've gone and almost put like around 11 subjects in final year for us with 9 papers. So six papers, sorry. So any advice on how can we cover such a huge chunk of syllabus in? I mean, I'd say now it's 11 months. I think.
To be honest, I think I'll be a good person to advise this, because in AIMS we don't have these third year exams. We have only final
Oh,
year exams. Yeah,
oh,
so
that would be
like,
great.
yeah, so most of I think almost all colleges have these ENT, Ophthal, PSM, and I think some few exams before. But in AIMS, it's always been like this only. All the exams only one prof at the end. So I don't know, maybe like kind of, in one way it's good, I would say, because there are some subjects like ENT, Ophthal, it's better to just read them how much is required for your PG entrance, to be very honest. Because once you get into any branch except that branch, That is opthal if you're getting into, okay. But otherwise, any branch you're going into, you don't need much of this. It's not the same with medicine, not the same with, obs gynae, pediatrics. Even obs gynae, you should know to a decent extent. Even CCM biostatistics also you should know. But something like ENT, getting into the depths of it, it's not required. How much ever you need for your PG entrance, which is also a good, decent bit, that much is enough. And similarly, you can, even in your final year, whatever previous year questions, only that much. So limit yourself with respect to these minor subjects, whatever your dharma also. Unless you're interested, that's a different thing. But derma, psyche, ENT, ophthal, all, and I think they've given this also, right? They've given certain weightages also, if I'm not wrong, in the next
Yes,
syllabus.
they do have weightages. Yes.
Yeah. So based on that, you allocate your time. Do
Okay.
not compromise on your basic main ones like your medicine. Again, not saying you go read Harrison, whatever, wherever you're reading from, read them well, because again, that helps a lot. Because if you look at your PG entrance exams, indirectly, a lot of questions come from medicine. Even path is a part of
Exactly.
medicine, right? Either you can
Yes.
say you read path, pharma, physio, and your medicine is done, or you say you do medicine and rest everything is done, right? So a lot of it comes from that proper medicine. At least I think I would say maybe 35, 40%, 35% at least of your NEET PG and your INI is medicine, including everything, your pathophysiology, everything. So it's very important. So don't skip, don't compromise on medicine, but you can, take that calculated risk on ENT of Thalon minors. Keep minors to minimal. CCM, only read whatever is needed for the exam. It won't help much. Surgery, etc., whatever is, always keep that previous year questions and whatever is important, and concept wise, whatever is important in mind, and go ahead.
Okay. So I was like looking at your LinkedIn profile, and the first thing that popped up is your health tech AI company, or I don't know. There's no much, not much information about it actually on your LinkedIn. So I was really curious, like, what is this about, and what do you have to say about it?
No, to be very honest, I don't have a company or something. I just,
Okay.
I just talk to people and I meet people. I go to conferences, and I, try to interact with people, try to look for potential windows. It's very much upcoming. It's not an established space, right?
Okay.
So one of the major areas, like we have our social medias, right? We have Instagram, we have Facebook is almost, I think, like it's a very weird space. Nobody is looking at it seriously.
Yes.
Yes.
Yeah. So we have our Instagram, we have Twitter, we have LinkedIn. If you look at your Instagram, even YouTube, obviously. So YouTube, Instagram, Twitter, there's not much of serious talk going on with respect to AI. If you look at Instagram, if you look at my Instagram, I have a healthtainment, health
Yes.
plus
Yes.
entertainment profile as
I've seen it.
well.
Yes.
Oh, yeah, yeah. So with respect to LinkedIn is one place where proper AI talks are going on, and I got a few, links and, leads with like health tech startups. I'm not linked to any one of them officially, but yeah, I'm just looking at opportunities which can be there. So I just put it up like that, so that if any, a startup founder or some company guy looks at it, if somebody, it's obvious, right? Healthtainment, I put it on LinkedIn. Nobody is on LinkedIn to look for entertainment. People are
Yeah.
there to,
Obviously.
yeah. So that's why I created that kind of. It's not that I'm not interested and I just kept it just like that, but I don't have any ongoing stuff going on there. I'm in a DM course also, right? So
Yes.
uh, I'm kind of caught up. Yeah, maybe in the
Pretty
future.
busy. Maybe in the future, hopefully.
Yeah.
So, how,
S
how would you advise us to choose a branch for postgraduate? So, like, how did you choose pediatrics as your postgraduate?
Again, it was a little bit weird only. Like, firstly, my initial choices were radioderma, because I'm someone who wants my own time a little bit, not so much of, work, etc., etc. So nuclear medicine was also a choice. But at the same time, I'm not someone who wants to, chill in the free time. I want to do something, but not in the medical space only. So that was one reason I wanted to radio derma nuclear medicine. I did join nuclear medicine in AIIMS-Delhi itself, and I did for a month. But then I felt that this is not. Yeah, I did for a month nuclear medicine. But then I felt that no branch is actually completely ki you can do it like a part time or something. You have to give it a good 3 years, at least 3 to 4 years, to establish yourself. If whether it be derma, like people talk that derma is cool, radio is cool, etc. That doesn't mean your residency will be cool. Maybe going ahead when you're a consultant, etc., you'll have good amount of free time, but not definitely not in your residency. So that's what I felt. If you take pediatrics, if you take medicine, if you take anything, main one where you're caught up is your residency only. After that, even as a pediatrician, you can be cool. You can just join a small job, and it's not like nobody's forcing you to work 9 to 9. There are options to work 9 to 9, and most of them take that option. So I thought residency anyway you have to be hectic only. Like hectic only means you have to
Yeah.
give your time.
Yes.
So I'd rather go into a place where I'll have more branching out options. So obviously I was unsure only what to do exactly. I was also not sure about myself. If I'm taking nuclear medicine, will I be able to crack through these other things that I'm thinking about? So I was always a little bit unsure. So that's why I took, you can say, a safer decision. Got into pediatrics, completed, and I'm into that kind of thing. So yeah, for you, your first question was how to decide. So
Yes, sir.
basically, I would say first and foremost should be interest. But at the same time, I know that lot of people don't have any specific interest. If you do have an interest, go all out for that branch. Don't run behind college and all, whether it be MD, whether it be your DNB, MS, whatever. Go and choose that branch, and you will go up in that. That is your first foremost thing. But most of the people don't. So then obviously your other factors come into picture. How do you want to live your life, what your lifestyle wants to be. And if that is also not a priority, then what I usually say is choose a branch which gives you options ahead. For example, radiology. I know it's a difficult branch to get, but I'm just giving you an example, because that is one branch where there's a lot of versatility. That is, you can chill, you can go into intervention, you can go into entrepreneurship, you can be in a you can be in a corporate hospital. Similarly, I think pediatrics also is like that. You can do your DM, you can do DM in adult, you can do in pediatrics, you can you can just be a pediatrician, you can be in a corporate hospital, you can open your setup. It's very versatile. So if you're very much confused, choose versatile branches. Even anesthesia is one such branch. You can be as an anesthetist, you can do DM critical care, which is not very difficult to get as an anesthetist. You can, so you can freelance, you can try to build your own ICU, all of that. So
Uh,
that's how I would, simple way.
Thank you for clarifying that, sir,
That's
because I had, huge doubts about how postgraduate and how to choose, uh, like which branch. And
I'm
talking
pretty
about,
sure I'm not, I'm pretty sure I'm not clarified. You'll still have doubts, but yeah, I just try to, yeah. Overall, it's something like that. Yeah.
yeah, because I feel eased out because I've had this huge like confusion, like what to take, what I'm gonna like miss out, or is it going to be like a good decision or not. And also on the lines of like work, I would like to ask, how's work life balance, how are you managing that?
No, like as I said, no work life balance. It's out of your control, mainly in your residency period.
Okay.
Whatever your, especially your first 2 years, whether it be your MD or DM or MCH, first 2 years of that residency, your work life balance is not in your hands. So especially in like I've been in your shoes. I've been in a final year MBBS pre-finals when I see my seniors going to your residency. I see Twitter and I see that everybody is posting about toxicity, about not able to eat and all of this work hectic, toxic, all of these words. But just to give you a heads up, it's mainly if you're not doing, suppose you're not doing DMMCH, it's mainly for 1 to 2 years. One first year it will be very hard, no doubt about it. But first 1 year is at your age. I would say again depend on person to person, but I think many people can tolerate if they have that in their mind that it's only 1 year. Many people can tolerate 1 year. Second year will be much lesser. Again, depends on branch and institute. It'll be much lesser, and third year will almost like it'll be lighter than your final year MBBS. Definitely, I would say final year MBBS is a different kind of pressure, right, with respect to the studies and everything. So final year MBBS, I think for me final year MBBS was quite stressful, I would say, compared to MD and all. So don't worry a lot. You're already taking good stress. It will not be very bad. Physically it might be, but mentally it won't be.
I would say we are in the end game now, so
Yeah,
that
yeah.
would be the thing.
Final year MBBS, especially because there's a lot of uncertainty. It's not like PG, right? PG, okay,
Yeah,
you have some backup. You are giving an entrance. If not, you'll give it again 6 months later. Some kind of solace is there, but here it's a little bit more stressful.
yes, sir. So I wanted to ask you about this one particular thing. What is so different about, let's say, a top government college like Osmania or Gandhi or any other colleges, and your central institutes like JIPMER and AIIMS and PGI? Like, what's so different about this? What makes them special? I would say that okay, the medical education is pretty common, like for everyone, right? So, what's the one defining factor which like differentiates it from everyone else, in your opinion?
Uh, I think central institutes also. You're talking about MBBS or you're talking about MD?
I mean, MBBS, MD, everything.
MBBS is college, MD is hospital, right? So
Yes.
both are a little bit different. So coming to MBBS, I've seen AIIMS obviously firsthand. PGI there's no MBBS, and JIPMER I've seen my interns and my whoever is their juniors. So JIPMER is, I think, quite similar to your Usmania Gandhi. Obviously, I have friends I know indirectly only, not directly. But what I felt was Usmania Gandhi, JIPMER, in terms of how the students' mentality is, it's pretty much similar mold. Matlab, they're quite sincere. They're not very eccentric. Obviously, I'm not talking about this the academic quality. Academics in JIPMER is like excellent. It's better than AIMS, to be honest. But at the same time, students are very very seedha. Matlab, they'll study, they'll go a lot to the sports complex, then they'll come back, rest, study, go to class. That is how their usual thing is. In AIMS, what is kind of negative and positive is there's a lot of freedom. So and people by default, I'd say, like, because they're usually the kind of the topmost people in the country, their brains are also a little bit erratic. So they will be very few people will get lost in maybe gaming and a little bit of addictions, etc., while few people will be completely into studies. I know few of my batchmates who right from first month they were like, I want to be a neurosurgeon in the US, and they started off research from first year. So they'll be very
Wow.
different. But if you look at from the college perspective, there's a lot of freedom. The academics is okay. I would say it's not very great in AIMS. But I think the best part about AIMS is the alumni culture and also the exposure you get to a lot of extracurricular things. For example, people, as I told you, they're different. So they'll be doing a lot of different things. Like, for example, you know an academy, right? So
Yes.
an academy's founder is 2 years senior to me, Roman
Oh.
Seni. So
Oh.
and like I took a, like you took you're taking my interview. I took an interview similarly with Roman Senia for my own college magazine. So
Oh,
things, those interactions, and you interact with a lot of IAS seniors. You interact with somebody who's doing finance in the US, MBA, like did MBBS names, doing MBA finance in the US and working as a chartered accountant there. Then I have 2006 senior who did MBBS, MD radiology, and then he left everything, did MBA, and is working in Boston, not Boston per se, Boston Consultant Group, BCG is a name. So in Bangalore, and he's completely into finance and management. So there are so many people, and you get exposure to a lot of things. And at the same time, alumni group is also very strong in the sense, you go anywhere, you call them, they are very very helpful. That obviously you would have heard this in a lot of interviews, and
exactly. Yeah,
yeah.
I've heard
So this,
about the alumni part.
yeah, alumni group is very strong, and for me personally, my favorite thing would be the exposure. Like other colleges, teaching is good, students are brilliant. Like I wouldn't say, especially in medicine, with respect to the hardworking nature, I would say AIIMS, whoever passes out, graduates, they might not be as good as doctors as the other colleges, because you need a sense of hardworking nature and a sense of doing protocol wise work. That is a little bit less. Like they're always like, because of the freedom in their growing years, they're a little bit here and there. So that way, AIIMS is a little bit different, I would say. JIPMER, I think, if you want to be pure very good doctor, I felt JIPMER is the best college. Students are very sincere. Their internship, they're super sincere. No comparison with AIIMS only. They are like, you get a feeling that these people are going to be really good doctors. But at the same time, they have very little, exposure to other things. For example, I don't think very few would be doing UPSC, very few would be venturing into business. So, to be honest, it's not fair for me to comment on how other colleges are. I've not seen them firsthand. I know people who
Right.
are doing UPSC and all from other places also, but I felt it's a little bit more, even USMLE also, etc. It's a little bit less in state colleges compared to
Yes.
cent- yeah.
I have heard podcast and a lot of people talk about the alumni, how they're so helpful, and it's basically a very good network of people, great network of people. You would say. Yes, that's great to hear. So, and one more thing, I think a lot of your batchmates considered USMLE as an option, right, in their college years, and I
Yeah.
think you might have also considered it at one point. So, what do you think about that pathway? If you haven't, even if you haven't, like according to your experience, or what do you think about it?
No, actually, at the time I did not, because like I've always been like I want to be in India, etc. So at the time I did not, but if I go retrospect, so initially I didn't think about going to the US because I wanted to stay in India only. Retrospectively, though, I would think that seeing how much time it takes to eventually complete super specialization and start off your proper career, like including obviously you'll take a little bit time for your PG cracking, little bit time for your SS cracking, and that too I could study stuff, and then I could get lucky also. There's a lot of luck involved in these exams. But US, it's much simpler. You will get medicine pretty much easily. Pretty much you can do it back to back. No need to have that PG to SS gap also, and then complete it off and you can come back, right? So that option, I it's not like I didn't know only before, but I always felt that I would not have the mood to do it. I might feel okay, okay, I'll stay back. Or what happens is that you always see your seniors who have been doing PG there, and you see that they have had a super increased kick in their pay, and all of this happens in your US. I always thought I might not have come back, but knowing me now, obviously at this age I would have come back even then. So that is one thing that I might have done. And again, I'm not sure, but maybe I might have completed of everything there and come back. I would have come back 2 years earlier to what I'm now. So that is there. So maybe I could have done that, but otherwise, personally, I didn't want to go. But if you ask me just from a perspective of any any other medico, I would say it's a great option. uh, like especially work related things. Others, obviously, there are other factors, etc., that is personal, but work related things, they're better there, obviously, there's no doubt.
Yes, sir. I've heard it's more like a overall life decision than just taking an exam.
Yeah,
So that's what even I was considering it at a point, and I just wanted someone I wanted to ask it to someone, and yeah, thanks for giving me that advice. Um, Next question.
So, as you said, there's like more freedom in AIMS doing a MBBS in AIMS. So, what advantage have you taken, sir? Like of the freedom, like what were your
of the
hobbies? Not like that, but
okay.
like you have the
Yeah, yeah,
freedom to
yeah,
do
got it.
anything, right? So, what were
Yeah, yeah,
you doing?
yeah. Time pass, like I used to, not nowadays, but I used to play a lot of sports. We had a lawn tennis court. I used to play table tennis. To be very honest, the physicality of it kept decreasing.
Okay.
First year I used to play a lot of badminton and lawn tennis. Then second, third year it went down to table tennis and lawn tennis. Then third, fourth year it went into foosball. I don't know if you heard of foosball, like proper foosball, not just for time pass. We used to
Okay.
play, like, a lot of foosball, and I think table tennis was something that kept continuing. And then final year it was final year and final year internship, it was FIFA and poker.
Oh,
So it like I played a lot of things, but yeah. Then in MD also I continued gaming, like I almost professionally, you can say. Like I played like 4 5 tournaments, FIFA and all, and just time pass PUBG and all. But yeah, that's what I usually do. Yeah.
that sounds like a lot more fun, sir.
Yeah. You might be thinking, I'm aware. Like if you see my MBBS course, you'll understand that okay, I was not very studious.
And
Even I'm very interested in FIFA. So I play it a lot. It's one of my favorite games since I was a child. I think you're interested in football as well. I would say.
I'm a United fan, so now I'm not. Currently, I'm not so.
Okay. Not so interested right now.
Yeah, like if I just see highlights. If they do something good, I see.
Oh yes, sir. I think yesterday they won the game. They're
Yeah.
14th place right
Bruno
now in the
scored a
Premier
hat
League.
trick.
Yeah,
Yeah,
Bruno scored a
Real
hat trick.
Sociedad. Yeah, it's just that much only. Whatever comes on YouTube. Earlier, I used to follow well, especially till the time Ronaldo joined. I used to follow decent amount. Then
Okay.
Ronaldo left, and then it was like pretty much bad.
It's very chaotic, that club.
Yeah.
so, football aside, I am a huge cricket fan, sir. And
Yeah, cricket, obviously. Cricket, needless to say.
yeah.
I'm also a huge, obviously, cricket and an SRH fan.
Oh, so who's your favorite player in SRH right now? Like,
Currently, currently, I think Abhishek, Abhishek, and like I don't love Head and Klassen, etc. But obviously there are players, so I would obviously support them. I like the way Pat captains, and player wise, I think Abhishek is my favorite player in SRH. Like he's the star, right? He's the Indian star. We left
It
one.
feels kind. Yes, sir.
Yeah, we left one Sharma, 12 years back. They're not going
Yeah,
to
one of
leave
the,
the other star Sharma.
yes. Feels weird to have them in SRH like after they've beaten us in the World Cup. Like they're the ones who
Yeah,
actually
yeah,
killed us.
Initially it felt weird, but the way they kind of revived our whole team, you kind of end up uh, kind of owning them, kind of. Yeah.
Game winners there.
Hmm.
So another question about your field only. So, like, I wanted to ask, like, you chose pediatrics, right?
Yeah.
After that, you went for rheumatology. So, why did you go for rheumatology? So, like, I wanted to know more about
So when I chose pediatrics, I was not completely like I won't do pediatrics and I'll shift to adult only. Although I had it in my possibilities, but I did consider pediatric gastroenterology as one option, and pediatric rheumat also I was seeing. But uh, like, you're asking why rheumat, or you asking why I shifted to adult? Why rheumat? You're asking
So, like, what's the pros and cons, I would say, of like,
of
why did you
rheumat.
go for rheumat?
So
Yes,
I
sir.
was
Is
I
it just
wanted,
your interest?
yeah, like
Yes.
like especially after I started preparation, like I became even more sure that I'm like, I took the correct decision. From even before also, I was interest was my main reason, because I always felt that okay, now we have done MD also. At least at this point, we should not be thinking about all the external factors, right? Like like whatever money or work life balance. So Rumat was purely an interest decision. Peds, you can say it included other things, like as I told you, somewhat safe side branch and everything that was there. Otherwise, I would have maybe given again exam, tried for medicine or something, or radio or something. But yeah, rheumat was purely out of interest, and yeah, I've been liking it only ever since. I was confused between rheumat and endocrinology, and I felt rheumat was even more interesting.
Okay. So, like, what do you think, like, would be the best candidate to like choose pediatrics? Because you've done your MD in pediatrics, right? So, what can an ideal MBBS student be like for to choose pediatrics? I would say. What would be your thought on?
I think cliche answer and first right answer would be that liking kids, right? Because talking to kids is a different art. Matlab, like
Exactly.
that, I think you would know by this age, by even 18, 19, when some kid. I'm sure girls by default like it more, but even boys to a certain extent they will like it. So that is one default thing. If that is there, then great. Apart from that, suppose what happens a lot of times is you want medicine and you don't get it, and you're just behind, and you end up, or you like take pediatrics. So in that case, I would suggest the minimum basic things, that you should have patience. Like, if because it can get difficult, not just purely difficult in terms of getting irritating, but also sometimes you feel quite sorry for the child, because at the end of the day, when you're cannulating him and he's crying, it's not just irritation, but kind of helpless. Okay, why am I kind of creating pain for him, etc. So that patience should be there. And rest, I think ideal candidates are people who like patient gratification. Those who like patient gratification will get that happy feeling when they see the child getting discharged. And so that if somebody has that at the top of their priority list, then peds is a great branch. And another positive, if you look from the practical perspective, is that it's very versatile. As I told before also, you can do a lot of things once you get into the branch. If you're not sure, then peds is a great branch. You can just go complete the residency, and then you can have a lot of options how you want to live your life.
So another thing, people even consider the financial perspectives of a career. Like,
Yeah.
if I'm seeing, even when I'm choosing a branch, I would like to see how financially independent I will be, and will it be fulfilling for me? So, what do you think about the current scenario of pediatrics, like in our job market today? Can a pediatric like earn a good amount of money, or like what do you think is the earning right now? Is it good, or is there a saturation in the market?
Firstly, any branch, it depends on the location, right? Depends on the location you're getting and the type of work you want. So if the type of work, in the sense you can be vaccinating kids and taking care of basic needs in a tertiary town or a village, and you can earn very well, but you just after doing MD pediatrics. But at the same time, if you want to stay in Hyderabad and you want to not do DM, then it's a little bit tough. Then it won't go more than 1.5 lakh per month. Talking figures, 1.5 lakh per month or so. More than that, it takes time. If not effort, it will take time. Or you're giving lot of time per month you're giving, that is different thing. I'm talking normal 9 to 6 type of work. So that is the usual pay that happens. Or if you want to stay in Hyderabad, you want to earn more, then obviously you can do DM, especially branches like critical care, branches like neonatology. They are paid well. They are paid, especially pediatric critical care, neonatology, pediatric neurology. They are paid just almost like how much adult DMs are paid approximately. So maybe starting maybe somewhere like 3 to 4 per month, and then after that it is very varied. Actually, I also don't know, because it depends on a lot of factors. It depends on how the person is, like how enterprising is he. Enterprising, not just, I'm not talking about unethical things and all. I'm talking about, for example, if somebody has a personal brand on Instagram, for example, so he can pull a lot of patients to himself. So some things like that. So depends on a lot of things. It's not standard ones. I'm just talking about the starting basic pay only, I can tell you, right? That is standard. So that is how much it is. Then it depends on a lot of things.
So after a certain point, it's a hustle, you would say. Just how much a person does.
Yeah, actually, if you don't want to hustle in medical field, best way is to go into government sector. Like, it's pretty chill. Like, you won't work more than, I think, I don't think you'll work more than 5 hours per day. Proper work. I'm not talking staying. You may stay till 5, but proper work you won't work more than 4 hours, 5 hours per day max. And in that you will earn well. You will earn 1.5 to 1.6. Then after 3 years, 1.8. Then 2.5, 3. By the time you're 40, 45, 4, 5. I'm talking about current inflation rates, not what will have been. So like that. So if you otherwise, it's hustle culture in all professions, no?
Yeah.
Yes, sir. Actually, it's
Rishabh
hustle
Pant
culture
didn't
everywhere.
play, Rishabh Pant didn't play even one match, no, in Champions Trophy.
Yes.
So
Yes.
you always have to be on your toes, whatever.
Exactly. So one like this is more of a very curious question, sir. I really like to present cases and in these conferences, so I'm really on the lookout for very rare cases or any bizarre cases. So, has there been any case in your experience, like till now, that you've encountered and was very like special for you, or anything like any funny incident or anything which was special for you? Any case?
Yeah, for rheumatology, it happens almost on a weekly basis, weekly or maybe
Okay.
not weekly, maybe 3 weekly or 2 weekly or monthly. If you look, House MD, right?
Yes.
So if you look at all the episodes, there are episode lists about what disease it is.
Yes.
So if you look at that, almost every 1 in 4 episodes will be rheumatology disease only.
Yes. Yes, sir.
So it happens a lot. In case you need some, uh, I mean, you're asking just from my
Like
perspective.
any case which was like very you remember for a long time, which was like
For example, there are not one, but there are few cases that come up as vasculitis. Vasculitis is inflammation of the vessels where there is, pulmonary nodules. There are some skin lesions, etc. And then they turn out to be malignancy. So
Oh,
those will be treated with in proper. For example, there was a patient who was treated properly as vasculitis in CMC Vellore. Why it was treated? Because it was not a wrong treatment. It was because certain serum levels of a particular cytokine were increased. Cytokine and immunoglobulin were increased. But at the same time, at that point, there was no tissue from where biopsy could be taken. Later, the patient developed a nodule where biopsy could be taken, and that point he presented to JIPMER, and we could take the biopsy, and then that revealed a malignancy. So things
okay.
like that happen quite a lot. Then there are some where infections mimic vasculitis. Like leprosy is usually very uncommon, right? In today's day and age, it's less common. So you kind of forget about leprosy sometimes. But then uh, that can mimic a vasculitis, and that's very important because vasculitis you treat with steroids, which are immunosuppressants. And at the same time, if you immunosuppress an infectious patient, it's dangerous. So that way, it's immune mediated disease versus infection confusion is always there because treatment is polar opposites.
Okay.
So
Sir,
of them will be.
I would like to add that leprosy isn't rare, sir, because last 2 weeks we've been seeing new cases of leprosy in our college, like hospital in
Yeah,
Nizamabad.
okay. Like I'm talking about, like I'm talking about, for example, 10, 12 years, 10, 20 years back, it was a very common differential of hypopigmented skin lesion. But now there are a lot of hypopigmented skin lesions that appear, but we don't consider leprosy as a main prominent diagnosis unless they have, some nodular appearances, etc.
So, before ending this lengthy podcast, I would like to ask, like, could you give us like few advices on how to like imagine you being in our shoes and like how would you like us to go forward in career and academics?
No, I think one main advice, no, whenever somebody asks, one main mistake that people do, even I did too, till a certain point. For example, I told you like till third, fourth year, I didn't study at all. In final year, I was like, I have to study now. Like now it's time, and I have to study. And then I started to, target Harrison, Bailey's, this, that, and like even when I gave very little effort in my second prof, I was, whatever, like 20th from behind or something like that. And in final year also, I gave a lot of hours, and still I was in the same spot approximately. So then I realized that I realized a thing that I've been always using, and that kind of changed my reading approach entirely. That you cannot read something that you cannot revise. So that is something that is very underrated. People read for example, you might read the entire pulmonology of Harrison. That means nothing. That means nothing if you're not revising 3, 4 times. So even if you don't read that, you read your whatever notes, coaching notes, you read that 3 times, you understand it, obviously. If you're not understanding, it's useless. You understand your whatever notes is there, whatever you're reading. This is true for your medicine. Medicine in the sense, our field. This is not true for something like maths or something where you have to practice. This is true for these memory-based things. If you're not revising, it's useless. So for my main advice is first itself choose your source which you can revise. Do not choose a big source. This is even very much more so important, and what I see the main mistake in students preparing for PG, they overestimate what they will revise. That is my main advice for you. Don't overestimate what you can revise. Our brain is limited. Our strength of putting efforts is limited, everyone's. So if, like Aditya Gupta, I think you might know.
Yes.
uh, yeah, so like whatever influencers are there, like these people, few of them are my friends. So they also say the same thing they say, whatever. So that is something, that is, if you can, just to make it a little bit sensational, that is the secret to success for many people. But even after telling a lot, it's difficult to understand, because they think somebody is reading this much, marrow this much is given,
Yeah.
so I have to read that much minimum. But no, marrow is giving material for your MBBS exams. Marrow is not, well, okay, they have some modules, but I'm just telling the whole content which is there, that is for clearing your MBBS exams. You can't read the whole thing, firstly. Secondly, do not jump and try to target rank one. That is also one important advice, because a lot of times you target rank one, you get 1500. Instead of that, you target 100, you get 100 or 150 or 200. So if
Yeah.
you're targeting rank one, you are reading everything what rank one needs to read. You won't be revising that. You will get 1500, 2000, whatever, depending on whatever you remember out of that. You target 100, you will read only what rank 100 needs. You will revise that, and you will go and give that amount of effort. Again, luck will be there. You may get 50 also, you may get 200, 300 also. So this is one thing that is always something that I learned after my final year, a lot wasted efforts. So yeah, so that is one thing. Always remember this. Rest, everything will take care. Don't stress out. Don't stress out on your exams. I think always I've like, obviously many juniors and etc. will ask, right, how to study, what to study. If you remember this important rule, no, everything will, you yourself will get confidence. If you're reading pulmonology Harrison's and you're not revising it, you will think, on the exam day you will think, oh, I had read, but I don't know what I'll write. But if you have read your notes, whatever it be, whatever coaching, whatever it be, but what, even if it's textbook also, that's also okay. Even if you have read Harrison pulmonology, you have read it 3 times, but again, you should know that can you do that or not. So you read it 3 times, then you'll have that confidence. So that is my main.
Yeah, so revision is key. That's a good advice.
Good key take from this.
Yeah.
So, any advice on how should we approach clinical postings?
uh Clinical postings, ideally, if you say, you should try to jot down whatever is there in the, like, I don't know, depends on your how your postings takes place. I hope a case is presented and the consultants asks
Yes,
questions.
yes,
So two things: one, what you could find, what was your interpretation. So I have not done this, but I know, some very sincere students who used to go to, for example, there was a case discussion of me. There was one sincere of me, in the sense I had to present the case. One sincere student used to come and see what my patient was, and she used to listen to the class, and whatever was there, she used to read in, whatever her source was, Harrison, for example. So that is the best way, I think. And I think if you do that, rest everything, even if you don't read Harrison later, no issues. But that what you'll read, you'll remember for a long time, and that'll form your concepts. That may not form your knowledge base. Your knowledge base later you may read from something else. You may read from Davidson, or I don't know, Alagappan, or something. But that whatever you read from your Harrison, no, that will form your concept base, and that will stay with you for a long time. When you read the other thing also, if you read the same thing, well and good. If you read other thing also, you'll remember that, and that will form a concept. So that's how I think the best way. And I think examination also, I think as much as possible, especially the basic things, always keep an eye. Even if you're not, obviously it's not possible to do examination every day. There'll be a lot of students in the batch, but keep an eye of what is happening in the examination. And that also, do not go into everything. So many things are given in your books. Not everything is important. Like, basic things, focus on basics. Double down on your basics. That's important.
that was my final question, sir. I won't take more of your time.
Yeah.
Uh, so that brings us to the end of this incredible conversation with Dr. Vishnu, sir. And a huge thanks to sir for his time and expertise. So you have been truly inspiring, sir, for us, and you're a role model. And one of the few people to get into all these top institutes, which is a very big dream of these medicos. And big thank you to our listeners as well for tuning in. Your support makes these things possible. And once again, thank you so much, sir, for joining us.
Thank you
Thank you
so
so
much
much.
for having.
Thank you so much. I ended the call. Thank you so much. Bye.